Topic of this video is congestive heart failure, or CHF. CHF is a chronic condition where the heart does not pump blood effectively. I'll be discussing the normal function of circulation through the heart, the disruption that CHF causes to that normal function, going over some of the symptoms that go along with congestive heart failure, and then discussing the prognosis and some potential options for treatment or helping to manage the condition. So, the heart's main job is to circulate blood. It pumps oxygen-poor blood into the lungs and oxygen-rich blood throughout the body. It does this through a series of coordinated contractions of the four chambers of the heart, known as the atria and the ventricles. It begins in the right atrium, where the oxygenated blood enters the heart from the body through the superior and the inferior vena cava. From there, it travels to the right ventricle and then up into the lungs through the pulmonary arteries. Gas exchange occurs in the lungs between the pulmonary capillaries and the alveoli, and then that oxygen-rich blood travels back into the left atrium of the heart by way of the pulmonary veins. From there, the left ventricle receives the blood and squeezes it out into the body through the aorta. So the core issue with CHF is the reduced cardiac output, meaning that the heart's not pumping enough oxygen-rich blood to meet the needs of the body, the cells, the tissues. So this happens in two main ways. Systolic heart failure is when the ventricles become stretched and weakened so that they can't contract effectively. This leads to a reduced ejection fraction, which is the percentage of blood in the left ventricle that pumps out every time that the heart beats. Diastolic heart failure happens whenever the ventricles become stiff and thick and prevent them from filling up properly. So even if the squeeze is normal with diastolic failure, the body's still not getting enough oxygen because the space in which the blood can fill is not adequate, still leading to less blood available to pump out. So the symptoms of CHF are going to vary depending on which side of the body that it affects predominantly. If the failure is predominantly right-sided failure, the right ventricle is failing to pump the blood into the lungs, and so it begins to back up into the body, causing fluid and swelling on the extremities and the abdomen, and this is known as peripheral edema. If the left side is the side that's having the failure, then the heart's struggling to pump the oxygenated blood out into the body, and so that blood is just backing up into the lungs, causing shortness of breath, wheezing, crackling in the lungs, coughing, a lot of pulmonary and respiratory issues. So while there's no cure, CHF can be managed long-term, depending on the stage of diagnosis, the age of the patient, and how compliant that patient is with their treatment and medication. So that leads us kind of to the treatment options. Number one, lifestyle treatments are going to include a healthy diet, low in sodium. Sodium draws fluid, water specifically, into blood vessels, which increases the blood volume, making an already compromised cardiac output worse. Along with this, being mindful of fluid intake can help to manage some of the fluid overload system aspects that come along with CHF as well. Exercise to help keep your heart healthy and strengthen the endurance of the heart. Medication options, if you're having fluid buildup, diuretics are an option to help pull some of the fluid off of you. Aldosterone antagonists can block the sodium retaining hormones which also help to keep your body from retaining so much fluid because of sodium. If the root cause of the failure is a coronary blockage, then a bypass is a surgical option that can alleviate the condition of CHF as well. In more difficult situations, VADs are an option. That's a ventricular assistive devices, which is a mechanical pump that helps the weakened ventricles to circulate the blood. And then if it becomes too dire, then transplant becomes an option down the road as well. So CHF does affect the heart's ability to deliver oxygen, but with a combination of lifestyle changes and medication and potentially surgical intervention, it is a condition that can be managed for years and sometimes even decades.